Welcome to Health Bulletin. Today, we turn our attention to the World Health Organization, the global body that was supposed to lead the world through the stormy waters of the COVID-19 pandemic. And yet, as the dust settles from one global crisis, another shadow looms on the horizon. It's called Disease X, a hypothetical name for the next unknown pathogen that could trigger another pandemic. So where is the WHO in this conversation? What's being done to prevent the next crisis? And more importantly, will their proposed pandemic treaty make any difference at all? After the chaos of COVID-19, the world has been talking about one thing, a pandemic treaty. The idea is simple, a legally binding agreement that would ensure nations are better prepared, more coordinated and quicker to act when the next pandemic strikes. Sounds good on paper, right? But how is the WHO delivering on this promise? Now, let's talk about Disease X first, a term that's become a catch-all for the next unknown viral threat. The WHO coined this term as a wake-up call, a reminder that there are pathogens out there, and we don't even know about yet. They could be lurking in the depths of a rainforest, in a wet market, or in a lab. Experts believe that it's not a question of if, but when Disease X will emerge. It could be deadlier than COVID-19, faster spreading than Ebola. And yet, while the WHO has acknowledged the threat, critics say their actions aren't matching their words. The WHO has set up the Global Health Emergency Course to monitor potential outbreaks, but is that enough? Are we better prepared than we were in 2020? The WHO recently provided an update on the pandemic treaty, including a possible deadline for its approval by member states. Here's what the WHO had to say.
We have Belisa Godinho from Portugal magazine, W magazine. Belisa, please unmute yourself.
The question is, how will WHO implement the global agreement on pandemic prevention and preparedness? What are the key points and which countries are involved? Thank you.
Negotiations on pandemic treaty are still ongoing, and we hope that countries will come up with a treaty or other legal instrument to help us be better prepared for next pandemic. The question was about pandemic treaty, and I don't know, maybe Steve is online. Maybe Steve, can you tell us a little bit where we are with the negotiations?
Thanks, and Tarek, it's very helpful that you recalled for our questioner where things stand. Member states, all 194 countries that are part of WHO, are actively negotiating now with the aim of delivering an outcome either in December of this year or next year by the World Health Assembly in May. So that would be May 2025. And that timeline was agreed by the member states at the last Health Assembly this year in May. So they're working with the aim of delivering a pandemic agreement for, as Tarek pointed out, the better global preparedness, prevention, and response to future pandemic threats. And the next meeting, formal meeting, will be next month. But member states are working informally all the time, and with the support of the Secretariat and the Director General, I think there's a lot of encouragement about delivering an agreement that will put the world in a much better position to work against future pandemic threats. Thanks.
Dr. Van Kerkhove, would you like to add something?
Yeah, I do. I want to just use it as an opportunity to emphasize that while the negotiations are taking place, and we're very hopeful that the negotiations will proceed and that we will have a pandemic agreement soon, pandemic preparedness, readiness, response is now. So we are working with all of our member states right now in a variety of different ways to ensure that we are ready for the known threats and we are ready for the unknown, the disease X threats that we face. We do this in multiple ways. We look at this through an emergency landscape of prevention, preparedness, readiness, response. We look at this through the capacities lens according to our HEPA framework of collaborative surveillance, community protection, safe and scalable care, access to countermeasures and coordination. We do this looking through specific threats that we know about, like respiratory viruses or arboviruses, and using a One Health approach because most of these pathogens are zoonotic in nature. So if we're looking from a public health perspective at preventing the next outbreak, epidemic, pandemic, we have to look at animals, we have to look in the environments that we share, and looking at how the drivers of spillover are changing with the changes in climate change that the world is facing right now. And we're also looking to support our member states in pandemic preparedness as it relates to governance systems and structures and financing. Again, we have many mechanisms that exist, like the Pandemic Fund, that are supporting member states with surveillance, with workforce, with laboratory diagnostics, which is very helpful to address the sustainable financing. And if I can, bring it also back to the investment round for WHO, why it's so important to fully fund WHO, because we are the secretariat of 194 member states. We work for member states around the world to make sure that the capacities that exist now are strengthened to have earlier detection and verification of these signals that are happening around the world, that urgent actions are taking place so any of these types of events can be mitigated and we don't see further spread, and that we are supporting with clinical care, we are supporting with infection prevention and control, and all of the different aspects of those response. So just wanted to use this as an opportunity to say that pandemic preparedness is happening now, even as these discussions are happening with the member states. But that agreement is so critically important because we have to do better the next time than we did during COVID-19.
So here's the big question. Is the world ready for the next pandemic? The WHO's pandemic treaty could be a turning point, but only if nations put aside their differences. Will they? Or will we find ourselves scrambling once again when disease X inevitably comes knocking? Thank you for watching Health Bulletin. Be sure to subscribe for more insights into global health and science that shape our world. Stay informed, stay prepared.